All right, you are asked to see Mr. Parker, a 42-year-old man with epigastric pain and vomiting for the past 6 hours. When you walk in the room, you see a middle-aged man who is uncomfortable and vomiting. The nurse hands you this admitting form. Based on this presentation, what additional historical information would you want to ask the patient?
Well, I'd want to confirm that, in fact, he's never had any symptoms like this before. He has no history of gastrointestinal disease, but never anything like this before. I'd want to know about his past medical history, particularly a history of hypertension, since he's a little hypertensive here, and if he truly takes any medications. I'd want to know what he was doing when the pain started, if he finds that anything makes the pain better or makes the pain worse. Sharp abdominal pain. I would want to know if he's vomiting. I'd want to know what that vomitus looks like. I'd want to know his last bowel movement and what color the last bowel movement was. I'd like to know his social history, if he's a smoker or a drinker, or if he uses any illicit drugs. I'd like to get a family history, and I'd also like to get a history of unintentional weight loss over the last number of months.
All right, doctor, thank you. You asked about previous episodes or past medical history. Why?
Well, I think the best predictor of his diagnosis today would be previous diagnosis of the same or similar.
All right. You also asked about alcohol use. How is that helpful to you?
I think the alcohol use is important because it can affect the GI system in a number of different ways. It can be a direct irritant to the stomach. It can be associated with nausea and vomiting, and that can give even erosive esophageal problems.